continuing our journey down the face towards the neck, we can talk about evolution of facelift techniques. And I think it's quite interesting. The facelift techniques are some of the oldest techniques in cosmetic surgery. The term ritidectomy essentially means removal and excision of wrinkles. The original facelifts done at the turn of the last century were direct excisions of wrinkles on the face, right where they occurred. And this evolved eventually into the older facelift techniques, which are subcutaneous lifts, which is what we probably mostly think of when we think of facelifts. So the subcutaneous lifts are essentially an incision in front of and behind the ear where we just do a dissection as surgeons underneath all of that skin and basically tighten it up and remove what's extra and suture it back down. And that may be what many of you think is a modern facelift surgery, but it really isn't. The problem with this surgery was that these patients often began to droop again pretty quickly. And in fact, in the 70s, I wasn't practicing then, but the people I know who were have told me that they told their patients to expect to come back in 2 years for a tuck-up procedure. So it was expected that in 2 years this would essentially fail. You need to come back and get tightened up again. And as I mentioned before, a lot of what's going on in the face is drooping of the deeper tissues, gravity effects and loosening of the deeper tissues of the face. So by just tightening the skin, you're really not treating the problem. And that's where the SMAS facelifts came into vogue. The SMAS is an acronym for the superficial musculoepineuritic system. That's quite a mouthful, but all you really need to know about that is that the SMAS is a fascial layer which suspends many of the important structures of the face and muscular tissues of the face. And as that descends, that provides a layer that we can, as surgeons, dissect and elevate and get a much more natural, long-lasting result with our facelifts. In the 1980s, the SMAS lifts became popular. And in this case, simply an excision of a small section of the SMAS in the vector that you want to pull, which is sort of superolateral, and suturing of that tissue, in addition to the subcutaneous lift, gave much longer lasting and better natural appearing results. So those are the SMAS lifts. And they're still used, and they can be quite effective. Next came the deep plane lifts, which took this to another level. And there's no pun intended there, but it really did. The deep plane lifts are essentially a further aggressive dissection in the sub-SMAS plane underneath that SMAS, all the way out extensively into the neck and into the midface. And this provided even a bit more dramatic and, again, natural appearing, though, and long-lasting result. And this is probably the gold standard for facelift today, the deep plane facelift, and it's a modified version of which most people, such as myself, use. The results are quite reliable. What's interesting is now, in the past few years, we're starting to go backwards, and we're starting to do less. The mini lifts, which I put in quotes because there's so many different terms being thrown about for mini lifts so that you don't really know what you're getting when you're getting a mini lift, basically involve less dissection and essentially less of a result. I think there are a couple of reasons for this happening. There are two primary groups of patients who are pushing for the mini lifts. There are people who are coming in younger and younger, so they maybe don't need so much correction, and so maybe there's no reason to do an entire deep plane facelift. If someone comes in their early 40s and just want a small amount of correction or something, a mini lift I think would be perfectly acceptable. There's also the category of patients who maybe would normally be a candidate for a deep plane facelift, but simply don't want to deal with 2 or 3 weeks of bruising and want to have something that maybe has a week to 10 days of bruising at the most, and they can get back to their activities quite quickly and are willing to accept something that isn't perhaps as dramatic. So I think that's one reason why we're kind of going back towards mini lifts in many folks. The term facelift is probably a bad one because obviously there's more to your face than the lower one half and the neck, which is basically what a facelift treats. So it treats neck laxity, banding, jowling. It somewhat treats the nasolabial folds and mid-face ptosis. Again, mid-facelifts are probably the best thing for that. People often think that facelifts do treat the skin wrinkles and things like that simply because you're tightening the skin so much. Well, really, you really don't want to tighten the skin that much surgically because it just doesn't look natural. It's best to do it with the other techniques which I talked about earlier. Typically, the operation is about 2 or 3 hours for a deep plane facelift, less for a mini lift. It's under light anesthesia. It's an outpatient surgery. The sutures and staples come out after about a week or so. Patients can shower the next day. Typical bruising is 14 to 21 days, and I'll show you an example in just a minute. Swelling lasts about 2 or 3 weeks, and makeup can be worn actually fairly quickly, probably less than 2 or 3 weeks. Let's look at a few examples. This is somebody who is a great candidate for a traditional facelift procedure. She has excellent bone structure. She has a nice angle to her neck. She doesn't have a lot of fat. She simply has some extra skin and some jowling. She's really interested in fixing this lower one half of the face and the neck. This is her the day I took her stitches out. So this is 6 or 7 days after the facelift. I hardly ever take pictures. I'm not sure why I did, but I'm glad because now I have this so that I can show people when they ask me about what it's like after a facelift. So she has some bruising. It's some under the eyes just from the surgery. It starts to, with gravity, kind of go to different areas, down into this portion of the neck where we didn't even operate, all the way down here. But the incision runs right here, into the ear right there, back around the earlobe and back. I've had her put her hair back so you could see that. These are her photographs about 6 months or a year later. And I think, again, we did nothing in the upper one half of the face, so nothing was done up here. You can see that along her jawline, rather than being squared, which was just one of the stigmata of the aging face, because of the jowling in these areas, she has a more nice, youthful, curvilinear appearance and much a more youthful appearing neck. And I think it's most dramatic on the lateral view, where you can see that her neck and jawline are much more youthful appearing, and her incision, again, is right along here, goes into the ear, back around the ear, and back into the hairline. So folks can often wear their hair back. In this day and age, we have more and more men coming into the practice for this type of surgery, and the most common reason is because they like to wear ties at work in the business world, for example, and they have some extra skin underneath the neck, and they like to deal with that. Again, this is an example of a man who's undergone this procedure, and I'm focusing on the neck. And again, the incisions are very acceptable all the way around the ear. This particular person wears her hair very short, and the incisions are quite acceptable.